Hi everyone, reporting here from ACR 2025 in our Go With Us to Conferences program. Quick update on a session that I saw specifically on Still's disease, which includes an umbrella of systemic juvenile idiopathic arthritis and adult onset Still's disease. It's considered actually the same disease, and in this study in particular, it was for a complication that can occur with Still's, which is called macrophage activation syndrome, or MAS. And the study was also for both pediatric, from newborn all the way up through adults, and how to get MAS, which is a very serious complication, sometimes even fatal, under control. And this is for people who are suspected of having MAS, have MAS, are having the episodes, and for chronic reoccurring, which is an unfortunate situation, but all too real. So this is a very good solution for people who have had it before and who may have it again. So the study, the objective was to really find a baseline, or a start line, if you will, of markers measuring three very specific biomarkers. Ferritin is one that most patients know that is associated with Still's disease. The other two, a little bit more complex in nature, but there were three altogether. So they wanted to measure a baseline with those biomarkers, or measures of levels in your body if they're elevated. And so they're targeting people who have those and being able to control those, what would happen if you control those three very specific biomarkers. So the findings were outstanding, which is super exciting. The qualifications also were you had to have failed infusion steroids. So if there was no good response to that, this would be the next line treatment. And saying that they wanted to make sure that people achieved a positive response and were in control within 8 weeks. Well, they far exceeded that. So 75% within 16 days, almost immediate, were able to get to more normalization. So that's exciting news. And by 8 weeks, 82%. And after 8 weeks, everybody had reached a good place. But their goal at the study was to do 8 weeks. So this is a very promising therapy that has been approved by the Food and Drug Administration in the United States. I would have to look into where it is approved in other countries, but they were just presenting it as far as FDA at this one here. So exciting times for a lot of studying going on in Still's disease and complications. So just as that's applicable to many other diseases, just knowing that the importance of understanding biomarkers and our individuality and how we would be able to potentially target treatments based on those is just something that's so amazing, and we're seeing more and more.